Welcome to The Explainer. Today, we're tackling a topic that affects literally millions of people globally, colorectal cancer. Now, it is one of the most common cancers worldwide, but here's the truly fascinating part. It's also one of the most uniquely preventable threats we face in modern medicine. Okay, let's dive into this. Today, we're tracing a clear patient journey. We'll start with understanding tumor biology, move on to risks and warning signs, then look at the power of screening, diagnosis and staging, and finally wrap up with treatment and survivorship. All right, Section 1, Understanding Tumor Biology, Anatomy and Cells. So colorectal cancer isn't something that just pops up overnight. It typically develops very slowly, usually over several years. It almost always begins as a completely harmless-looking precancerous adenomatous polyp. And this slow transformation, what doctors call the adenoma-to-carcinoma sequence, is exactly what gives us this incredible window of opportunity to prevent it entirely. It's like catching a spark before it becomes a wildfire. Now, if a polyp isn't stopped, it starts to physically invade the layers of the bowel wall. It begins right in the innermost layer called the mucosa. But over time, as it turns cancerous, it grows deeper. It pushes into the submucosa, then forces its way into the thick muscle layer, the muscularis propria, and eventually it can even breach the outermost layer, the serosa. It's just a relentless, progressive invasion of tissue if it's left unchecked. Zooming in to the microscopic level, your normal epithelial cells are doing their job perfectly, right? They're constantly turning over and repairing their DNA. But when cancer develops, genetic mutations literally take over. We start seeing genes like APC and KRAS mutating, there's chromosomal instability, and things like MSI, which is microsatellite instability. Basically, these mutations hijack the cell. They turn a healthy repairing tissue into a rogue, invasive cancer that can even create its own blood vessels and spread. Moving on to Section 2, Risks and Warning Signs, Protecting Yourself. Okay, so what are the red flags? You want to look out for blood in the stool or rectal bleeding, persistent changes in your bowel habits or stools that are pencil thin. Other major warning signs are abdominal pain, unexplained weight loss, and fatigue caused by iron deficiency anemia. Why does knowing all this matter? Well, because ignoring these specific symptoms gives the disease a free pass to advance. It can sometimes even lead to a severe bowel obstruction. So listening to your body here is absolutely vital. But, how do we even get to that point? While aging and certain genetic conditions, things like Lynch syndrome or familial adenomatous polyposis, play a role that we just can't control, we need to look at the other half of the equation. Things like obesity, smoking, heavy alcohol use, and eating a diet that's low in fiber but high in processed and red meats. The takeaway here is actually incredibly empowering. These are highly actionable risks. You literally have the power to change them. Which naturally leads us to a very common and very important question. Can polyps become cancer? Well, yes, they absolutely can, as we've just seen. But honestly, the better question is, how do we stop these polyps in their tracks way before they ever turn malignant? That brings us to Section 3, the power of screening, preventing cancer. Screening is the real hero of this story, and we have two amazing frontline tools here. First up is the FIT test. It's fantastic because it is a totally non-invasive stool test that you can just do at home. Super easy. But if it comes back positive, you will still need a colonoscopy. Now, looking at the colonoscopy itself, yes, it requires some prep work, we all know that, but its massive advantage is that it doesn't just detect precancerous polyps, it allows the doctor to actively remove them right then and there. A total game changer. Let me paint a picture of how this actually plays out in a clinical setting. Imagine a patient goes in for a 1-hour routine screening colonoscopy. Barely 1 minute into the procedure, the doctor spots an adenomatous polyp. 10 minutes later, a polypectomy is performed, meaning the polyp is completely gone. Fast forward into the future, and colorectal cancer was 100% prevented. All because they just showed up for that 1-hour appointment. Now for Section 4, Diagnosis and Staging, Clinical Guidelines. When a diagnosis is officially made, doctors use what's called the TNM system. That stands for tumor, nodes, and metastasis, to stage the cancer. Stage I is highly localized. It's superficial. But as things progress down to stage 4, the cancer has unfortunately spread to distant organs, like the liver, the lungs, or the peritoneum. Seeing this progression really hammers home exactly why early detection is just absolutely critical to a patient's prognosis. Now, arriving at that accurate stage requires a very specific, progressive diagnostic path. It always starts with a medical history and a physical exam, followed by a colonoscopy and a biopsy. Next up is histopathology and lab tests to check for specific markers like CEA levels. Then they'll use imaging, CT, MRI, or PET scans to check for any spread. And crucially, step 5, molecular testing. Confirming that biopsy and mapping the tumor's specific molecular profile is absolutely essential before a single treatment even begins.
Finally, Section 5, Treatment and Survivorship, Modern Oncology.
Treatment has evolved so remarkably over the last few decades. Traditional systemic chemotherapy regimens, things like FOLFOX or CAPOX, are still incredibly effective workhorses. But today, we're increasingly using targeted therapies and immunotherapies. These are highly precise treatments, like VEGF inhibitors or pembrolizumab, and they're selected based specifically on that molecular testing we just talked about. We are literally matching the exact drug to the tumor's unique DNA.
Let's look at a really inspiring scenario of how this actually works for a patient. Say, in month 1, a patient is diagnosed with colorectal cancer, but their molecular testing reveals they are MSI high. Because they have this specific marker, in month 2, they're started on immunotherapy. By month 6, they show an excellent tumor response. Their very own immune system is doing the work to fight the cancer. And by year 1, they enter active survivorship. I mean, this proves the incredible life-saving value of modern molecular testing.
But treating the tumor is really only half the battle. Thriving after cancer requires comprehensive rehabilitation. Early mobilization and physiotherapy get the body moving again. Nutritional rehab restores much-needed energy. If surgery required it, specialized stoma education is provided. And finally, robust psychological support. Because true survivorship isn't just about the physical disease. It treats the whole patient: physical, nutritional, and mental.
So how do we keep ourselves out of the hospital in the first place? Well, here's your evidence-based playbook for prevention. Eat a high-fiber diet packed with fresh fruits and vegetables. Commit to regular exercise and keeping your weight managed. Stop smoking entirely. Limit your alcohol intake. If you have inflammatory bowel disease, make sure you keep it managed with your doctor. And above all else, show up for your regular screenings. These everyday choices are exactly what actively empower you to prevent this disease.
I want to leave you with this really powerful message drawn directly from the medical guidelines framing today's explainer. Colon cancer is one of the most preventable and treatable cancers when detected early. Early detection truly saves lives. It's just a profound, completely scientifically backed message of hope. Which brings us to our final thought for today. Knowing exactly how preventable this threat is and seeing the incredible clinical tools we have to stop it right in its tracks, when will you schedule your screening? Thank you so much for exploring this vital topic with me today. Stay curious, stay proactive, and take control of your health.